why now? What's the rush? Why do I need this treatment? I want to go over some of the reasons as far as like health-wise, why this is such an important thing. And so the first thing is bone loss. And then the next thing would be just overall quality of life. So as far as bone loss goes, we've had patients in the past where they've been in a denture for a long time, or they've been missing teeth for a long time, and they came in for a consultation. We did an x-ray, and they didn't have enough bone to be able to place implants. And so for them, unfortunately, the result was, hey, you're just going to have to stick with your denture, and implants are just not an option. And honestly, it doesn't really need to take a lot of time. Every patient's different, and bone loss can happen faster for others. We've talked to people who've been in a denture for 15 years and was a problem. We've talked to people that have been missing their teeth for a year, and it started to become an issue. So every patient's so different. And so that's why we would recommend to come in, so that way we can take a free CT scan or CBCT, like a 3D x-ray, so we can see what's going on with the bone and seeing if there's enough to be able to place implants. And anyways, that's going to be a big thing. Is the thing that's nice about dental implants is that it preserves your jawbone density. It acts like a tooth root and basically makes it where your jaw isn't going to then recede like you do see a lot with patients who have dentures. So they typically have, more of a profound jaw structure. And then as the bone recedes, then the mouth starts to collapse a little bit. And when they take out the denture, you can really tell. I'm sure maybe you've seen a picture or seen somebody who doesn't have their dentures in and have had dentures for a long time. So that's what happens when we start to lose our teeth. And so what's nice about implants is it prevents that jawbone loss. The next thing would be just quality of life. So the big one's going to be confidence, and the next one's going to be functionality and pain, and then just oral health. So functionality and pain, part of that's like eating, chewing, that kind of stuff. So as far as confidence goes, we've had countless stories of patients where once they got their teeth done, they were able to get a promotion at work. Or, we had a patient where they're like, I haven't been on a date with my wife in 5 years because I'm so just embarrassed of my teeth and my smile. And, for them, he was able to get this treatment done and now is able to take his wife on dates, which just life's short. And so being able to have that confidence and is huge. We had another patient who literally wasn't dating anybody, got this procedure done, met a girl, got engaged and got married, and it was wild. It was really, really cool. And another thing is attending social events. We've had grandparents where they're embarrassed of being around their grandkids because their grandkids make comments, and it's just really, really sad to think that negating or delaying this treatment can cause so much pain and heartache, and avoiding a lot of the sweet things in life. Another thing is just goes all along with this. It's just being a better friend, spouse, parent, grandparent, and just being present and smiling. Just being able to smile is just such a huge confidence booster in every aspect of your life. The next thing is just pain. Having a lot of these dental issues can be painful. Dentures can be painful. And so being able to get these implants, it really is as close as you can get to your natural teeth. And then the next one is just going to be your quality of life as far as oral health, and your overall health. So obviously being able to eat the foods that you love and enjoy brings a lot of happiness, but also being able to eat a diverse set of foods is extremely beneficial for your body, for your health. And I remember talking to a patient that he was like, hey, I can only eat yogurt and cottage cheese and like basically as extremely soft and liquid foods. And that just can't be good for your health. And so being able to get the All-on-X procedure is just life-changing because it allows you to eat apples and eat steak and eat corn on the cob and just a variety of foods that can be so beneficial to your health. And then there's also been a lot of studies that have started to come out of the mouth-body connection, where your mouth really is the gateway to your body. And so they've found that there's a connection where having poor dental health can also be linked to arthritis, diabetes, emphysema, heart disease, high blood pressure, liver diseases, obesity, stroke, that kind of stuff. So there's a lot of benefits where taking care of the health of your mouth also just in turn takes care of the health of your body, your mental health, your confidence. Honestly, I think one thing that is really big, especially for people that are working as well, there's been patients where you take a look at them before, and then they get the teeth, their beautiful, perfect set of teeth afterwards, and they just look like a completely new person. And we've literally had patients who have gotten promotions, or they had the confidence to ask for promotion from their job because of this procedure. And so if you think about it, if you break this down into a monthly payment, there's probably some patients where the raise that they got from their job ended up just paying for and some for the cost of this procedure. So it really is life-changing, not only for your confidence, but also for your health.